Good morning and welcome to The Price of Business. This is William Edmondson, turnaround CEO, consultant, and entrepreneur, and today I'm filling in for Kevin Price. As always, we're here today talking about you and your business. Well, we've got a lot to talk about, but before we start, let me tell you that portions of the show are sponsored by Super Interns, Victory Transportation Systems, and Houston Jewelry, so thank you to them. Well, let's jump right in. We've got Ashok Mathur, and he is with Patagonia Health, and you can find them on the web at patagoniahealth.com. Good morning and welcome.
Good morning, William. How are you?
Doing great. Well, we're glad to have you on. Tell us a little bit about what you do over at Patagonia Health.
We are a software company. We make electronic health record for medical practices across the nation. This allows the clinicians to make appointments in the software as well as enter medication, allergies, and do the billing once the patient leaves the clinic. It's a complete workflow engine which is easy to use for medical practices.
Well, I've looked through your website, and it looks like you all are all about providing solutions to make things easier for the healthcare industry.
That's correct. Yeah. So, I have some background in electronic health record. I worked for a very large software company before, and the nurses and the clinicians complained a lot about that the software is very difficult to use. And so we started this company 6 years ago with a vision of providing an easy to use and yet comprehensive electronic health record software. So that's what we do, make it easy to use for the nurses.
Well, that's great, and it's so important now to keep everything as simple as you can, as much as there is going on. And, we all have apps that are simple to use in our day-to-day life. So it's great that Patagonia Health has brought that kind of idea into the medical industry, which can be so complicated.
Yes, you're absolutely right. Our life has changed, William, completely because of smartphones and the apps technology which came out in 2008. Until that time, the clinicians and the nurses were struggling with the antiquated software, which was very difficult to use because it really was designed not for the nurses, but it was designed for IT people to use. So we changed the paradigm and use the apps technology to make it easy to use electronic health record software.
Absolutely. Now, let me ask you a question. Now, first of all, congratulations for you all for being an Inc. 5000 company. So congratulations on that.
Thank you.
Yeah, so tell us a little bit about how you all became an Inc. 5000 company and what that's meant to you.
Well, it's been really a great honor and a privilege to be selected by Inc. As you know, Inc. does a ranking of the fastest growing companies, private companies in the nation every year. And we heard about it, so we applied, and we were kind of absolutely astonished, pleasantly surprised that we were in the top 5% of fastest growing companies in North America.
Wow.
Which really is great.
That's absolutely fantastic. And it shows that the product that you all have, is a solution to problems that people had on a day-to-day basis. So great job on that. Now, how long ago were you named to the Inc. 5000?
We got selected in September of 2015, only 4 months ago.
Oh, great. So brand new.
Yes.
Good.
It is also very interesting. We were really surprised because we are based in North Carolina, and you hear about Facebook and the Google and the Apple who are based in Silicon Valley. They're growing very fast, but it was good to know that even in North Carolina we can come up with innovation, which is really breathtaking.
Absolutely. And, it is all about really harnessing all of the change in technology and putting it to use for people. So that's fantastic. Well, now tell us a little bit more. I've been looking at your website at patagoniahealth.com and just looking at the different types of solutions and technologies. But tell us a little bit about who your ideal customer is.
It's a good question, William. As you know, there are different medical practices. We as consumers go to primary care physician, we go to cardiologists and so on. So we have focused on a couple of areas which are really underserved by the electronic health record marketplace. So these are the people in what you call local health department. As you may be aware that in each county in the nation, there is a local health department, and their main mandate is similar to CDC, to make sure that the county population stays healthy. So they focus on prevention as well as providing medical services to underserved. So they would make sure that our kids in the community are all immunized. They work very, very hard to make sure everybody's immunized at the right age. They make sure that any communicable diseases like STD or HIV do not spread in the community. They were very proactive with the TB, and recently, as you know, there were a lot of things about Ebola. So these are the frontline people in public health who make sure that our community stays safe. So we serve the local health department, the other clinic types.
I'm sorry, Ashok. Sorry, we lost you there for a second.
Also, could you hear that we serve local health department?
Yes, that's great. Well, you know, it's so important because, you know, a lot of us don't really like the government expanding, but boy, keeping everybody healthy and, you know, fighting diseases and things that could come up, that's a good, effective use of government, and we're certainly glad that you guys are helping with that.
Right. Yeah, we are very fortunate to be living in this country. You know, we have very, very good organizations for CDC who jump in, for example, for Ebola. We are very fortunate that it did not spread. In other countries, if it did not have public health, you know, we'll be suffering a lot. So we are very thankful for those kind of people.
Perfect. Now let me ask you a question. How did you all come up with the idea to create this product and this company?
Yeah, I work for a large electronic health record software company, and it was a pretty big company, top 5 in the nation. But their software was actually 20 years old, and it kind of feels pretty bad being a software technologist that we are giving these nurses and the clinicians and the medical doctors really very poor software. So we tried to improve the old product, but then you realize you can't take a 20-year-old jalopy and make it into new EHR.
Right.
So we decided in 2009 to start the company from scratch. We built the software using the new apps platform, which was coming out. We also use the cloud technology, which is coming out. So, you know, luckily we were at the right place at the right time, and everybody loves the apps and the cloud. So that's kind of where, you know, as I say, rest is history.
Well, that's fantastic. I know I was briefly running a software company that catered to the hospitality industry, and you know, you really do have to keep up with the latest software because there are so many different things that you can do, but you can't necessarily build it on the old technology. It just doesn't work.
Correct. Right. You know, the old technology was, they called client server. The doctors and the clinics have to have an army of IT people to keep the server running. There's ongoing maintenance and cost, which you can avoid with the cloud solutions. So yes, and it pays actually. A lot of our customers are switching from software they had 10 years ago, and really simplifies their life. Cloud-based and apps-based make it much easier. So a lot of the customers are switching, which is a good thing for us.
Well, that's fantastic. And again, congratulations on being an Inc. 5000 company. We've got about 30 more seconds. Is there anything else you'd like to tell the listeners?
Well, I think we've talked quite a bit. Thank you for the opportunity, William. But I would say that if they're looking for an easy-to-use electronic health record, they should check out our website. And the thing we are proud of, not just the product, but the service. We have a goal of 100% referenceability, which is very rare in our industry.
Fantastic. And you can find their website at patagoniahealth.com. That's patagoniahealth.com. Well, thank you for being on the show. Now remember, the best content here shows up at usdailyreview.com. We'll be right back with more Price of Business after this.